Welcome back. I'm Dr. John Shumway. Now that you know what prostate brachytherapy is and why we're passionate about it, let's walk you through your journey as a patient step by step. Our goal is to make sure you know exactly what to expect from your first consultation with us all the way through your treatment and into follow-up.
We'll cover how we evaluate and prepare you, how the procedure day works, and what the recovery and follow-up entail. We'll also talk about how we manage side effects and ensure you're supported throughout. Let's start at the beginning, the initial consultation.
When you first come to Western Radiation Oncology, you'll meet with one of us for a thorough consultation. We'll review your medical history, biopsy results, and any scans you've had like MRIs or PET scans prior to your consultation. During this visit, we will have a detailed discussion about your prostate cancer, its stage, Gleason score, PSA level, and what those mean. This is part of what we call the risk stratification group.
We categorize your cancer as low risk, intermediate risk, or high risk, and often use further sub-classifications. This is all based on nationally recognized and established criteria. We use your PSA, your Gleason score, and your tumor stage. Why does this matter? Well, because it guides the treatment recommendations. If you're low risk, active surveillance is often a good option. If you do choose to treat your prostate cancer, brachytherapy alone is sufficient and highly effective for low-risk prostate cancer. If you're higher risk, as we mentioned in our first video, we might combine brachytherapy with external beam radiation and possibly a short course of hormone therapy. During the consultation, we will explain our reasoning clearly so you understand our recommendations and the plan.
We know hearing all these details can be a lot to take in. We encourage you to ask any questions. No question is unimportant. Part of our consultation is also making sure brachytherapy is the right choice for you. We'll ask about your urinary patterns, how is your flow, do you get up often at night, any burning or difficulty, and your overall health. If you have significant urinary problems from a large prostate, say you have trouble emptying your bladder or a very weak stream, we might involve a urologist to optimize that before brachytherapy. In some cases, procedures such as a TURP, which is a transurethral resection of the prostate, a HOLEP, which is a laser procedure, or a PAE, a prostate artery embolization, may help shrink the prostate prior to brachytherapy. This can relieve obstruction and reduce the risk of urinary issues after the seed implant. We'll tailor this advice to your situation. Our priority is that when we proceed with brachytherapy, it's going to go smoothly and safely given your baseline urinary function.
We will explain all of your treatment options, not just brachytherapy. These may include surgery, external beam radiation, or active surveillance if appropriate. As radiation oncologists, we will, of course, focus on the radiation options, but we want you to make an informed decision. If brachytherapy is a strong option for you, we will focus the discussion on its pros and cons. We'll be honest about potential side effects and the expected outcomes. We'll also share with you the anticipated success rate for your specific case. Thanks to decades of data, we can often personalize your success projection by your risk profile. For example, if you're low risk, we can confidently say the chance of long-term cure with brachytherapy is on the order of 95 to 98%. If you're intermediate risk, we will discuss whether you can get brachytherapy alone or if we recommend brachytherapy in combination with external beam radiation therapy and/or androgen deprivation therapy. Even in high-risk cases, by adding external radiation and hormone therapy, we see excellent control rates that we can quantify based on similar patients we've treated and published studies. We will review these numbers with you so you have a realistic outlook.
By the end of the consultation, you should have a clear understanding of if and why brachytherapy is recommended and how it compares to other options. Many patients feel relieved to learn that brachytherapy offers such a high chance of cure with an excellent long-term quality of life. We often hear patients say, "That sounds almost too good to be true. Why wouldn't everyone do this?" Our job in the consultation is to discuss why brachytherapy is or is not the right option for you. Rest assured, if brachytherapy is part of your treatment plan, it's because we genuinely believe it's the best option to cure your cancer and preserve your quality of life.
Before you leave that first visit, we'll also discuss the logistics and next steps. For example, we might schedule you for a pre-planning appointment or volume study. That's usually a short visit where we do an ultrasound of your prostate, very similar to the diagnostic transrectal ultrasound you may have had for the biopsy, to map out the size and shape of the prostate. This helps us with treatment planning, essentially a roadmap for the seed placement. Sometimes we can use imaging you have already received, such as a prostate MRI, to create the initial plan instead.
We want you to leave the consultation feeling that your questions were answered. If you have new questions later, you can always reach out to us.
Once you've decided to proceed with brachytherapy, we move into the planning phase. Behind the scenes, our team will use the information from your scans to create an initial customized treatment plan. This plan is essentially a computerized simulation of your prostate and where we plan to place each seed to get the prescribed radiation dose. We carefully calculate how to distribute the seeds to cover the cancer while avoiding critical structures such as the urethra, the tube that carries the urine through the prostate, and the rectum. Every plan is tailored. Even the number of seeds and their specific radioactivity are very specific to you.
About a week or two prior to your implant date, we will order the radioactive seeds. Each seed contains a small amount of radioactive material, typically palladium-103. These come from a specialized manufacturer and are made to our specifications. When they arrive, we confirm their strength and calibrate our equipment. As mentioned earlier, your seeds are essentially made for you. Even the packing slip has your name. That's how personalized this therapy is.
Another part of planning for some patients is deciding on a rectal spacer. This is a relatively new innovation, a hydrogel, often known by brand names such as Space OAR and Barigel. It can be injected to create a small gap between the prostate and the rectum. Why do we do this? Well, we further reduce the radiation dose to the rectum. This is usually done about 1 to 3 weeks before brachytherapy, but it can sometimes be placed at the time of the implant as well.
As your implant day approaches, we give you a detailed set of instructions to ensure everything goes smoothly. Here are some typical preparations. Medications. Review all your meds. If you take any blood thinners like aspirin, Plavix, Eliquis, you'll likely need to stop them about 7 days before the procedure with your other doctor's approval to reduce the bleeding risk. We'll give specific guidance on this. Bowel prep. The evening before or the morning of the procedure, you'll do a bowel prep to empty the rectum. Often we'll have you do a fleet enema the night before and the morning of your implant, about 1 to 2 hours before you arrive. It's a quick over-the-counter enema to clean out the lower bowel so that the ultrasound imaging during the procedure is unobstructed and to reduce the risk of any kind of infection. We know enemas aren't anyone's favorite, but it makes a big difference in visualization and is very important for a successful implant procedure. Fasting. You'll need to not eat or drink after a certain time the night before, typically nothing by mouth after midnight. This is standard for any procedure involving anesthesia to prevent nausea or complications. Other instructions. We'll ask you to arrange for a responsible adult to drive you home after the procedure, since you'll be groggy from anesthesia and shouldn't drive that day. Wear comfortable, loose clothing. The morning of, take any essential medications like blood pressure or heart meds with a small sip of water as instructed by the pre-op nurse.
By the time prep is done, you will be all set for your procedure day, knowing exactly what to do. And of course, if anything is confusing, our team is just a phone call away. Now let's move on to the big day, the brachytherapy implant procedure itself.
On the day of your brachytherapy, you'll arrive at the surgical center or the hospital at the designated time, usually early in the morning, about an hour or two before your procedure begins. After check-in, you'll be brought to a pre-op area where you'll change into a gown. You'll meet the anesthesiologist. We'll go over the anesthesia plan and ask a few routine questions. Most prostate seed implants are done under general anesthesia, where you're completely asleep. You won't feel or remember anything in the procedure. The anesthesiologist will make sure you're comfortable and completely pain-free.
We'll also see you in the pre-op area to answer any last-minute questions and confirm the plan. We know it's normal to feel a bit nervous, but we'll reassure you, this is a routine procedure for us, and we anticipate things will go smoothly. The nursing staff will start an IV line, and when it's time, you'll be brought into the procedure room.
In the operating room, once you're under anesthesia, we position you similarly to how you would be for a prostate biopsy or any prostate surgery. Legs comfortably raised. A Foley catheter is placed into the bladder to help us visualize and avoid the urethra during treatment. A special ultrasound probe is placed in the rectum to give us continuous imaging of the prostate on a monitor. We capture images of the prostate, urethra, and rectum and create a three-dimensional reconstruction of your actual anatomy. This will help guide us in how we perform the implant. real-time intraoperatively. Under ultrasound guidance, we then insert thin hollow needles through the perineal skin, that's the area between the scrotum and the anus. This sounds intense, but remember, you're completely numb or asleep, so you won't feel it. The needles go into the prostate at precise locations, according to our treatment plan.
At Western Radiation Oncology, we use a specialized template or grid to guide our brachytherapy needles, ensuring proper spacing and trajectory. We combine this with real-time, intraoperative adaptive planning, which means we adjust the plan as we go, using live imaging feedback during the procedure. This advanced approach allows us to place each tiny radioactive seed with superior accuracy, targeting the cancer exactly where we want it. It also lets us carefully shape the radiation dose around the sensitive structures like the urethra to protect them. We deposit the radioactive seeds through the needles directly into the prostate tissue. We place seeds throughout the prostate gland, concentrating more in areas with cancer, while still creating a uniform cloud of radiation that covers the entire gland and a small safety margin beyond it. For example, a typical case might involve 10 to 15 needles to place roughly 40 to 100 seeds throughout the prostate. Without real-time adaptive planning technique, each of those seeds is placed with exceptional precision. This high level of accuracy means we can thoroughly treat the prostate and effectively target the cancer while minimizing exposure to the urethra and other nearby organs. This kind of precision is one of the things that sets our practice apart. It's also a key reason why our prostate brachytherapy outcomes are so good.
The entire implant procedure is efficient, often lasting between 30 and 45 minutes. Some of that time is spent making final adjustments and confirming placement with our ultrasound and our computer. As mentioned before, we use a technique called real-time planning, meaning we update the treatment plan on the fly if needed to account for any prostate swelling or slight movements in the anatomy. This ensures the final result is spot on.
Once all seeds are placed and we're satisfied with the implant based on the ultrasound images and our calculations, we remove the ultrasound probe and all the needles. Because the needles are thin, bleeding is usually minimal. There are no stitches required. The Foley catheter is removed before you wake up.
After the procedure, you'll be taken to the recovery area as the anesthesia wears off. Most patients wake up feeling groggy but with minimal pain. You might feel a bit of soreness or pressure in the perineal area, kind of like you fell on a bicycle seat, but it's usually fairly mild. We can give you Tylenol or ibuprofen if needed.
The nurses will monitor you after the procedure for up to an hour. They'll check your vital signs and make sure you're doing well. We typically will want you to urinate before you leave and go home. Don't be alarmed if there's any pinkish tinge or a little bit of blood in the urine. That's normal after having needles in the prostate gland. It should clear up soon after the procedure. Once you're more awake, we'll have you get up carefully, get dressed, and a member of the surgery center staff will review the discharge instructions with you and your family member or your driver.
If your procedure is scheduled for 8 a.m., you are typically on your way home by 10 a.m. You'll need someone to drive you as you'll still be a bit drowsy. We advise taking it easy the rest of the day. We will provide you with detailed aftercare instructions, including how to take your medications.
Speaking of medications, let's discuss side effect management, which is an important part of the journey right after the implant.
In the first few days after the seed implant, you'll likely experience some mild soreness in the perineal area. This is the skin between your scrotum and your rectum. It might be a bit tender when sitting. Over-the-counter pain relievers like acetaminophen, Tylenol, or Aleve, or even ibuprofen are typically enough if you have discomfort. We'll advise you that you might see a bit of blood in your urine or even in your semen if you ejaculate. This can occur for a couple of weeks and is expected as the prostate heals. It will gradually resolve.
The most common side effect in the weeks after brachytherapy involves urination. You may notice urinary frequency, needing to go more often, including at night, and urgency, meaning when you do go, you gotta go now. You might also feel a burning sensation when urinating, and your flow might be a bit slower or weaker for a while, as the prostate is swollen from the procedure. These symptoms usually peak in the first 2 to 4 weeks after the implant. The good news is that they are temporary for most men and improve gradually over the next 1 to 3 months. We help you manage these symptoms actively. We typically prescribe an alpha blocker, such as tamsulosin, also known as Flomax. This medication relaxes the smooth muscles at the bladder neck and within the prostate, helping urine flow more easily. Unless otherwise contraindicated for you, we typically recommend 2 pills every evening for the first couple of months after the procedure. One side effect that a small minority of patients can experience from tamsulosin is lightheadedness or dizziness, as it can decrease your blood pressure. And we typically advise patients to discontinue the medicine if you do experience one of these side effects. We also typically recommend a Aleve or naproxen twice a day, once in the morning and once in the evening, for 10 days after the procedure, unless you have a medical reason not to take NSAID medications, such as Aleve. In rare cases of more severe urgency or frequency, we could add other medications, such as anticholinergic drugs to calm bladder spasms, but that's not needed for the vast majority of patients. In rare cases, typically less than 2% of the time, patients can develop urinary obstruction, where they have difficulty emptying their bladder a few days after a procedure. If you develop this, we or your urologist can place a Foley catheter for a few days to let the swelling subside. Remember, this is an uncommon and not unexpected side effect. The vast majority of men do not have prolonged retention issues, especially because we carefully screen and manage large prostates beforehand.
Prostate brachytherapy generally has minimal to no bowel side effects because the radiation is so targeted. That being said, it is possible to notice a slight change in bowel habits, like mild rectal irritation or a little more frequent bowel movements for a short period of time. But unlike external radiation, brachytherapy alone rarely causes significant rectal symptoms. If we placed a gel spacer, it would further protect the rectum. If you do feel any rectal soreness, let us know, but it is usually not a significant issue.
All right, what about sexual effects? In the short term, brachytherapy usually doesn't cause immediate changes to erections. You may be cleared to resume sexual activity whenever you feel ready. There is a small caution we give, however. During the first few weeks, a condom should be used, not because there's any radiation exposure to you or your partner, but on the very off chance of a seed that could be released in the ejaculate. This is a quite rare event, but as a precaution, we suggest using condoms for the first few ejaculations. In terms of long-term sexual function, some men may experience a gradual decline in erectile function in the first few years after treatment. This can happen after really any prostate cancer treatment due to effects on blood vessels and nerves. However, the risk of impotence with brachytherapy is generally pretty low and lower than it is with surgery. Many men maintain potency, especially if they had good function before the procedure. If any issues arise, we have standard interventions, medications like Viagra, etc., that can help. We want to ensure that your quality of life remains high, and sexual health is a very important part of that.
A unique positive with brachytherapy is there's no significant risk of urinary incontinence in the long term, so you don't have to worry about wearing pads or leaking urine when you cough or sneeze. These are situations that are more common after surgical removal of the prostate. This is a huge relief for most patients.
Over several months, you'll notice the urinary symptoms improving. Typically by 3 months post-implant, many patients report they are 80 to 90% back to normal in terms of urinary function. By 6 to 12 months, some even forget they had the treatment, except for the fact that they still need to have their PSA checked. Everyone's timeline is a bit different. Some experience a PSA bounce, though this is quite rare. This means a slight rise, then fall around 12 to 18 months after brachytherapy, which can be normal. Your urologist or oncologist can help you interpret any PSA changes. Speaking of PSA, let's move to follow-up.
We will typically call you to check in a few days after the procedure. The purpose of that phone call is to check how you're feeling and address any side effects you may be having. We'll make sure your urinary symptoms are improving and adjust any medications if needed.
Your PSA will be the main test we use to monitor for cancer control. After brachytherapy, PSA doesn't immediately plummet to zero. Instead, PSA will slowly trend downward over 6 to 24 months. Your PSA will typically be half of your initial value at the 3-month follow-up and then continue to go down after that. We typically recommend PSA blood tests every 6 months for the first several years. So for example, if you had your implant in January, we'd want you to get your first PSA in April and every 6 months after that. We want to see a downward trend. There may be small ups and downs. Again, a temporary rise or bounce around 1 to 2 years is something that can happen and is not an immediate cause for concern. Eventually, we expect PSA to reach a low point, often called a nadir, typically below 2 by 2 to 3 years post-treatment. This indicates that the cancer is in remission. After that, we just ensure it stays low.
While most patients return to their urologist for long-term follow-up and care, rest assured, we are always available. If at any point you have a concern, whether it's a new symptom or a question about your PSA values, you can call us.
Some side effects can occasionally show up later or persist, though typically milder. For example, some men might notice they continue to need to stay on the Flomax for a longer period to keep optimal flow. That's okay. If you have any lasting symptoms, we will work with you to manage them. The vast majority of our patients, however, report that after a few months, they feel pretty much back to normal, with the huge benefit of having their cancer cured.
If your treatment plan includes external beam radiation after brachytherapy, typically for higher risk cases, let's touch on that. Typically, we wait about 6 to 8 weeks after initial seed implant for you to heal before starting the external beam portion. This allows acute swelling and irritation from brachytherapy to settle down. Around that time, we or your local radiation oncologist would simulate and plan your external radiation and then treat you over several weeks, commonly 5 to 6 weeks of daily treatments. The follow-up process after combination brachytherapy and external beam radiation is the same and involves PSA monitoring.
The take-home message here is that after brachytherapy, we are always available when needed. Your local urologist typically sends us your PSA or other results, and should anything unexpected occur, we will make an appropriate plan for your situation. For instance, if the PSA were to rise significantly down the line, we could discuss salvage treatments. But let's focus on the positive. With brachytherapy, the odds are strongly in favor of long-term control. Many studies have shown 95% of patients with low to intermediate risk cancer remain cancer-free at 10 years after this treatment. Even in higher risk groups, outcomes are still excellent with combined therapy.
And remember, these statistics aren't just numbers, they represent lives. Men who have gone on to enjoy their retirement, time with family, hobbies, all without prostate cancer getting in their way. We want the same for you. We will even use your individual data to project your personalized chance of success. As Dr. Kurtzman mentioned, it's one of the empowering aspects of our consults. It feels good to know, okay, I have a very high chance, over 90% let's say, of beating this, or whatever the figure may be in your case.
We hope this walkthrough of the patient journey has given you a clear picture of what to expect. The path from consultation to cure involves multiple steps along the way, but each step is manageable and you will be guided by an experienced caring team. Our philosophy at Western Radiation Oncology is to combine the highest level of technical care to effectively treat your cancer with unwavering support and personalization. We want you to live your best life.
We know that trust is the foundation of the doctor-patient relationship. By explaining everything up front and being there for you at every juncture, we aim to earn and keep your trust. When you're on the treatment table for brachytherapy, you can feel confident that you're in very skilled hands. We treat every case like we would our own family members.
In summary, your journey will look like this: consultation to evaluate and plan, workup, including any necessary prep like the spacer or addressing urinary issues, the implant procedure, a one-day outpatient event, and recovery, which is a few weeks of gradual symptom improvement with medications help. And finally, follow-up, regular PSA checks and visits every 6 months to ensure long-term success. Along this journey, we'll manage side effects proactively and keep you informed. And of course, we celebrate the milestone of cancer remission once your PSA drops and stays down. That's the outcome we're all working towards.
Thank you for taking the time to learn about the process. We find that patients who understand what's coming feel less anxious and more in control. If you have any further questions, please don't hesitate to reach out to us.
It's our privilege to be part of your care. Prostate brachytherapy is a treatment we truly believe in because we've seen the excellent outcomes and the lives restored firsthand. High cure rates, low side effect profile, and personalized patient-centered delivery. That's what we stand for at Western Radiation Oncology.
We look forward to guiding you through a successful treatment and seeing you thrive in the years ahead cancer-free.
Until then, take care and know that you're in good hands.